The convenience of the 21st century transportation means there are fewer restrictions on international travel and fewer safeguards against cross-border disease transmission. Taiwan is an important transportation hub of the Asia-Pacific region, vulnerable to the spread of infectious diseases from other parts of the world. Taiwan CDC has been set up to manage this vulnerability. Taiwan CDC comprises of 6 technical divisions, 2 centers, 5 administrative offices, and 6 regional centers that are responsible for the prevention and control of infectious diseases in Taiwan, national preparedness and response against bioterrorist attacks, and the surveillance of disease outbreaks overseas. Together, the divisions, the centers, the offices, and the regional centers form a highly mobile and comprehensive disease prevention team. Taiwan CDC regards epidemic prevention as a war and is committed to protecting the safety and health of the people in our nation. Disease prevention transcends national boundaries, and Taiwan cooperates with countries around the world in collecting and exchanging information on global epidemics. Taiwan's disease prevention team can mobilize quickly to visit any area affected by epidemics to acquire first-hand understanding of an outbreak and provide on-site assistance. When the line of defense returns home, Taiwan's borders are closely guarded by airport and seaport quarantine. Fever screening is the primary quarantine tool, and incoming travelers with abnormal body temperatures or symptoms are asked to practice health self-management. Citizens are also advised to avoid visiting areas affected by epidemics to prevent infectious diseases from entering Taiwan. Taiwan CDC is the key public health agency in Taiwan. During outbreaks of infectious disease, Taiwan CDC cooperates closely with local governments to swiftly implement epidemic control measures. Every year, about 12,000 new tuberculosis cases are reported in Taiwan. Taiwan CDC has implemented the national plan to halve TB incidents in 10 years, with Find TB, Cure TB as the primary strategies to curb the TB epidemic in Taiwan. The overall target is to reduce the national age-adjusted incidence of TB to 36 per 100,000 by 2015. The DOTS and DOTS Plus programs provide quality care to TB and multi-drug-resistant TB cases. Enhancing contact investigation and endorsing latent TB infection treatment are other key strategies we have implemented to reduce the risk of developing TB disease. Since the first HIV/AIDS case was identified in Taiwan in 1984, the cumulative number of HIV-positive persons in Taiwan has now exceeded 20,000. Among them, the proportion of injecting drug users has risen steadily since 2005. In 2006, Taiwan CDC launched a harm reduction plan and has successfully decreased the incidence of HIV infection among injecting drug users through cross-sectoral initiatives featuring health education and consultation, HIV screening, needle exchange services, and drug replacement therapy. Unsafe sexual practice is the major route of HIV transmission, particularly among MSM, which is thus a priority population for prevention. A comprehensive surveillance system, health education, and screening of high-risk individuals and free heart services have also been implemented. In addition, through cross-governmental discussion, Taiwan CDC enacted policies to address the issue of unsafe sexual behavior among injecting drug users. Dengue fever is a disease of the tropical and subtropical regions with an Aedes mosquito population. Since the 20th century, there have been several major dengue fever outbreaks in Taiwan. In recent years, dengue fever prevention efforts in Taiwan have focused on effective management of cases and outbreaks, health education, and community mobilization to clean up and eliminate mosquito habitats in the neighborhood. In preparation for a possible flu pandemic, Taiwan has devised 4 strategies and 5 lines of defense. A stockpile of disease prevention materials, including personal protective equipment, antiviral drugs, and novel flu vaccines, has also been established. To provide appropriate patient care facilities and medical care, the Communicable Disease Control Network has been established. The country is divided into 6 regions, with a commander assigned to each region who is responsible for coordinating distribution of medical resources and assessing each region. When necessary, triage will be carried out to ensure normal functioning of the medical care system. In late spring or early summer each year, Taiwan enters the epidemic season for enterovirus infections. Following the philosophy that prevention is better than cure, Taiwan CDC is committed to promoting frequent hand washing and the practice of good personal hygiene, and constantly reminds parents of the signs of a severe enterovirus infection so that cases can be promptly treated and enterovirus-related complications and mortality among children reduced. The R&D of biomedical products plays a crucial role in the disease prevention system. Taiwan CDC's Vaccine Center is working to develop a vaccine for type 71 enterovirus, a cell-cultured vaccine for Japanese encephalitis, and antivenens against local snake bites. The center also collaborates with international partners, introducing high-quality vaccines in Taiwan to increase national vaccination coverage. Taiwan CDC's Research and Diagnostic Center is responsible for overseeing the national effort in laboratory testing and research of infectious diseases. The center has 12 laboratories equipped with advanced equipments, including automatic amino acid sequencers, nucleic acid extractors, and single-point gene mutation testing systems. There are also P3 level laboratories for research into high-risk pathogens. The center provides a speedy infectious disease testing service for the people in Taiwan. Taiwan CDC has set up a national influenza center to integrate a range of services, including surveillance of seasonal and novel influenza activity, laboratory testing and verification of flu cases, preparation of antibodies against local influenza virus strains, and data exchange with domestic and overseas laboratories. Taiwan CDC has launched a National Health Command Center, an integrated national platform for collecting epidemic information and coordinating disease control efforts. It quickly gathers data on international epidemics and keeps track of domestic situations by staying in close contact with disease control centers throughout Taiwan. Real-time data ensures that appropriate and timely response measures are taken. Taiwan CDC has won many battles against infectious diseases, its achievements widely recognized by the international community. Under a comprehensive epidemic disease prevention system, Taiwan CDC will adhere to its core values of humanity, professionalism, communication, proactivity, and teamwork to build an ever stronger safety net against infectious diseases for the people in Taiwan.